So if you were asked, do you want colon cancer or not? What would you say? Well, of course you would say you don't want it. I don't know anybody who would answer that and say they wanted colon cancer. Of course, you will say, I'll take a pass on that one. But we still have 60,000 people a year that die from colon cancer. And 1 out of 20 people will be affected by colon cancer in their lifetime. We can change those statistics. We have the answer, and it's with screening. So I have heard every excuse in the book as to why people have not gotten their colonoscopy. And it typically ranges. People will say, oh, I don't want somebody sticking something up my bottom. They don't want to do the prep. They're worried that it's going to hurt and there's going to be pain involved in having the procedure done. But by far, the most common excuse that I have is that we just don't have time. So let's look a little bit closer at those excuses. To have a colonoscopy, it is very important to do a bowel prep. This is the way that the stool is actually evacuated or removed from your colon. This allows the doctor to be able to see the lining of the colon and be able to identify polyps or potential cancers to be treated. When you come in for your colonoscopy, you will actually be given medication so that it is a pain-free experience. While you are being sedated, your doctor will insert the colonoscope into the rectum and gently and carefully advance it through your colon and be able to evaluate the entire lining of the colon. Now, the last excuse was, I don't have time for this. But I would question, if you don't have time for a colonoscopy, do you really have time to get cancer? So who needs a colonoscopy? Who needs to get screened? Well, if you have a colon, you need to be screened. The big question is, though, is when? When does that need to start? Average risk patients should start screening at age 50 with a colonoscopy. Depending on what's found at the time of the colonoscopy will determine when your next colonoscopy might be required. You can actually help change these statistics. You can save a life. Get yourself screened and help encourage the people that you care about to also get screened. Colon and rectal surgeons are experts in the surgical and non-surgical treatment of diseases of the colon, rectum, and anus. They have completed advanced surgical training in the treatment of these diseases, as well as full general surgery training. Board-certified colon and rectal surgeons complete residencies in general surgery and colon and rectal surgery, and pass intensive examinations conducted by the American Board of Surgery and the American Board of Colon and Rectal Surgery. They are well versed in the treatment of both benign and malignant diseases of the colon, rectum, and anus, and are able to perform routine screening examinations and surgically treat conditions if indicated to do so.